My educational background started just north of here. I graduated from Mount Vernon Nazarene University undergraduate, and from Mount Vernon I went to medical school at Wright State University in Dayton, and from Wright State University I transferred to Riverside Methodist Hospital to do my internal medicine residency, and from Riverside Methodist Hospital I went to the Cleveland Clinic Foundation to do a cardiology fellowship for 3 years. And then I stayed on as a staff cardiologist at the Cleveland Clinic 5 years after that until coming to Zanesville. My favorite thing about being a physician is actually getting involved in people's lives. Not only from a medical standpoint, but even a personal standpoint. A lot of people that I take care of own farms. And I do have a background in natural resources. In fact, that's one of my degrees from college was natural resources. And oftentimes we slip away from medical diagnoses and medical talk back into farmland and cattle and a bunch of other topics that are a lot of fun to talk about. I said, I've been at Genesis for about 20 years. I left the Cleveland Clinic Foundation about after 5 years of being a clinical cardiologist there. And an opportunity came to me about starting a new era in Zanesville, including open heart surgery and interventional cardiology that was well adapted at the Cleveland Clinic Foundation, and that I was really well involved in. And it was a great opportunity to bring excellent care that was rendered at the Cleveland Clinic Foundation and bring it to a community where those procedures or those interventions were not able to be done. So it was a great opportunity. Why did I stay here 20 years later? Is not only did we bring that new technology to Zanesville, but we're able to deliver the same quality of care that was being done at the Cleveland Clinic Foundation in a small community. And that's the real reason why I still stay to practice here today, is because we can, in a small community, deliver excellent cardiovascular care that's delivered at any other institution in the world. There's one patient that I took care of a pretty long time ago around the Christmas season. And it's a lady that I took care of that had a lot of cardiac problems, but was sent to me to be evaluated for heart failure, but she didn't have heart failure. She was significantly swollen, and I made a diagnosis of lymphoma on her. And I remember rounding on her at the Christmas season, and I really didn't have to, but a family member came up to me and hugged me and appreciated the care that I've rendered the 5 to 7 years previously that I took care of her. And I realized at that time that physicians not only take care of the patients, they were also intimately involved in patient families. And it, at that time, made my interaction with that family very much worthwhile. I chose the specialty of cardiology in medicine from my training at Riverside Methodist Hospital with some of the interventional cardiologists. It was the one profession where people could come in with significant illnesses and within 24 to 48 hours of a severe illness walk out of the hospital like nothing ever happened to them. And it was very exciting to be involved in a specialty where you could take very sick people on one day and watch them completely well the next day. I have this weird ability to capture a lot of people's favorite interests or hobbies when I see them in the office. And it's kind of funny that it gives us something to talk about on return visits, and I can remember exactly what their interests are. So something outside of medicine is always important. It's even important when you're in a hospital and they're relatively sick. Oftentimes patients do not like to think about or talk about their illness, but if you can have another topic to sit down and talk with, it brings a smile to their face. The wildest change in cardiology that has occurred over the last 20 years that I would have never thought would ever happen was the percutaneous treatment of significant blockages in coronary arteries, particularly with the new stents that are being placed. But the more fabulous procedures being performed today that are mind-boggling is the replacements of valve percutaneously, such as the TAVR procedure, which is a percutaneous placed bioprosthetic valve that's placed in the aortic position. It's phenomenal because it's finally technology that we can give to patients previously not felt to be surgical candidates. It's pretty mind-boggling. One thing I wish everybody that comes in contact with me, particularly family members, as well as patients, is that they realize that the care that I render is in myself the same type of care that I would render to any of my family members. It's out of deep love that I do this and care. One of my favorite stories and success stories in cardiology occurred when I was at the Cleveland Clinic. I was called to see a lady that had the acute onset of neck discomfort, presented to the emergency room department, and was pulseless at the time of my arrival to bedside. I've heard of stories like this from my training and felt that she probably had an aortic dissection, and I ordered an echocardiogram stat, at which time confirmed the diagnosis of aortic dissection, and she also had a large fluid accumulation around the heart called a pericardial effusion. Now, it is contraindicated to drain that fluid when someone has an aortic dissection, but I decided to drain it anyway because I thought that was the only way that she would survive. I drained the fluid, she gained her pulse back and became conscious. I flew her to the Cleveland Clinic Foundation emergency since I saw her in a satellite office in Medina, Ohio, and she survived and is alive today. It's probably the greatest turnaround I've ever seen a patient have in my 20 years of being a cardiologist.